My pleasure. Good afternoon, everyone. Welcome to the Monterey County Wednesday media briefing. Today I'm filling in for Maya Carroll. My name is Karen Smith. I'm the Public Information Officer for the Health Department on my usual days. So today we're going to talk about public COVID questions, an overdose symposium that's going on, and Suicide Prevention Month. So we'll get started with Dr. Moreno. Do you have any report, or you just want to take messages or take questions?
Can you hear me?
Yes.
Okay. Yeah. Oh, yeah. Public health has no COVID announcements, but we can take questions. Oh, sorry, Karen, can't hear you. Hey, Karen, still can't hear you.
I don't have any questions. I don't see any questions in the chat. Oh, wait a minute. I spoke too soon.
So, Karen, can you hear me?
I can hear you. Let
Okay.
me, did I mute everybody? Let's see. We do have a question.
Okay.
The FDA approved use of the new bivalent boosters for the Omicron variants BA.4 and BA.5, and the CDC is expected to follow suit. Does Monterey County Health Department have a standing order that will include the new boosters as soon as they are fully approved?
Yeah. So Monterey County Public Health, I can't speak for the county or the department, but Public Health will be awaiting the result of the ACIP meeting, and they say they can't hear me, or there's a person there says they can't hear. Karen. Okay, Karen, can you hear me now?
I can hear you.
Okay.
Let me see. Oh, shoot.
For some reason, I'm getting muted.
I wonder. It's let's see. I'm going to make you a co-host. Maybe that'll make a difference. There we go.
Okay. All right.
Is that better, guys?
All right. Someone else said they still can't hear me.
I'm sorry for the technical difficulty, guys.
Let me try something.
Oh.
Let me try something. Let's try this. I'm trying a different speaker. How's that?
Thumbs up, thumbs down, people.
I got it. I got different speaker. I got 2 people thumbs up. All right. How about if I answer the questions, and then if someone can't hear me, then we can maybe send out a response. How's that?
Okay, that sounds good to me.
All right.
Sorry about that, guys.
All right. So Public Health will be waiting for the results of the ACIP meeting, which I believe is tomorrow, later this week. And then we'll be awaiting the recommendations of the CDC as to how the bivalent COVID vaccine can be administered and to whom.
Okay. Anything else? Anyone else? Oh, got another question. If the new boosters are bivalent and carry information from the original COVID-19 strain and the dominant Omicron variants, sorry, I lost my. Can a person who has not been yet vaccinated start with the new booster, or do they need to start with the original?
So thanks, Karen. So these are really good questions, but again, we have to wait till the ACIP meets to consider the FDA's latest position, and then we'll be waiting for the CDC recommendations to come out, and then we'll know who's eligible and how we can administer the vaccine.
Okay, and I typically don't do this, but I'm taking one off Facebook, which I typically don't do. But what is the protocol for COVID positive people? Can they still be seen in doctors' offices? Are all doctors' offices doing what we call test and treat?
My recommendation is you call, if you have a doctor's appointment or need to see a physician or seek health care, to call a facility before you go.
I have another question. According to the health department website, 72.2% of the county's residents are fully vaccinated for COVID-19, yet only 53%. I lost my, sorry guys. Yet only 53.4% have at least one booster. What can the health department do to increase that number?
I think people need to continue to be aware that there are recommendations for people to be fully vaccinated, and for certain individuals to get boosted. And those individuals that are fully vaccinated or boosted have a lower risk of hospitalization and death. So that's still a recommendation to get fully vaccinated and boosted to prevent your likelihood of being hospitalized and dying.
Any more questions? I'll give you a little bit of time to write. And it looks like that's it for today. Thank you, Dr. Moreno.
All right, Karen, take care.
So next on our agenda is discussion about today is, if for those who may not know, today is Overdose Awareness Day. So we're going to talk about the Overdose Awareness Symposium that's going on later today. But now we have Jorge Rubio and Reina I practiced this. Alcala. Sorry, Reina.
That's okay. Reina Alcala.
Ah, okay. Go ahead.
Awesome. Yeah. So good morning or afternoon, everyone. My name is Reina Alcala, and I'm the director of our prevention department with Sun Street Centers. And then we also have here Jorge Rubio, who is our outreach specialist with Sun Street Centers. And we're just going to take a few minutes to invite you all to our event that's happening tonight from 6 to 8 p.m. It's our Overdose Awareness Symposium. And we are trying to invite the general population throughout Monterey County to come down to the sports complex this evening and hear a little bit about and participate in a discussion about the uptick in drug-related overdoses that we've been seeing throughout our county, and get a little bit more information. We also ask some questions to our guest speakers this evening. We have a variety of different guest speakers. We have Dr. Reb Close and Casey Grover. We also have Haida coming. We have local police department from King City, Chief Keith Boyd. We also have the Monterey County Probation Department. We have Assistant Chief Jose Ramirez that will be speaking, and then Officer Jessica Madueño from the Monterey County Highway Patrol. So there's going to be a variety of different guest speakers that will be talking a little bit about the information that or the data that they've been collecting, or the trends that they've been seeing in their professions out in the community as either first responders or as professionals in the public health field, collecting this information, and as well as just addressing any concerns that the community may have, either parents or youth, or welcoming anybody that really wants to get more information about the topic. I know we have been seeing more on our local news about fentanyl overdoses, so we will be also talking a little bit about that and distributing Narcan as well. So we'll also be having Haida will be distributing fentanyl testing strips as well. So they'll be discussing a little bit about that, how to administer information about the testing strips, things like that. So it's going to be a very informative event. We will have childcare, raffles, community service hours for youth that attend and want to participate. So Jorge, if you would like to add anything else to that, or if there's any questions.
I think you covered it pretty well. This project has been in the works for a few months now with the collaboration and partnership of our Parts Coalition. So it's been really nice to see all these different agencies coming together and supporting one another again for the safety and the health of our communities. And we actually wanted to choose August 31st for the same reason that we wanted to join the different communities across the world, just because it's this international campaign. So we wanted to also be part of that worldwide, and put ourselves on the map as well, because this is happening all across. It's not just happening in certain communities. So That's a big part of it. So everybody, again, everybody's welcome. Like Reina mentioned, that there will be dinner provided, raffle opportunities, community service hours, and childcare will be provided as well. So we're encouraging youth, parents, families, even different agencies that work directly with youth, or individuals that maybe are vulnerable to an overdose. It would be good to get this information just to learn more about, what's out there.
So if anyone has questions for our guests from Sun Street Centers, I do have one question about the symposium. Is it going to be in Spanish and English?
Yeah, so the event will be entirely in English, but we do have translators available that evening thanks to the county health department. So we'll be able to have translation for anybody that would like the presentations to be translated into Spanish.
Thank you. So, any questions about this important topic?
I would like to add, we do have a few agencies, including some of our guest speakers that will be there prior to the event starting around 5 to 6 p.m. that will be having a resource fair with a couple of just additional information that we would like the public to take home as well. So if you are interested, even in checking out that portion of the event, that would be open around 5:30. So feel free to join us a little earlier to make sure that you get additional resources if you would like to speak to any of those agencies that are joining us this evening as well.
And again, that event is this evening.
Yes. It's at the sports complex. It's Lena Sports Complex, and it's from 6 to 8, but doors open at 5:30. The resource fair will be in the beginning. That will stay out throughout the event. So if you can make it at any time, that would also be another opportunity if you're interested in that portion of the event.
So just looking for any questions. I don't appear to have any questions. You guys covered it very. Oh, wait. I have a question up in the corner, Kat. No, no, that was just your hand.
Sorry,
moving.
I'm listening and working on spreadsheets, so
It's
think
okay.
I'm like,
I saw a hand. I saw the traditional hand, and I almost didn't know what to do in this world. Okay,
Apologies.
so thank you again, Reina and Jorge. Well, I hope that we see lots of people at tonight's symposium. Thank you.
Thank you for having us.
Thank you.
And next we'll move on to Dana Edgel. She's with the Monterey County Health Department's Behavioral Health Bureau. And she's going to talk about Suicide Prevention Month, which starts tomorrow, and all the events that will be happening and the importance of this month. Thanks, Dana.
Thank you, Karen. And I also do want to mention that September, in addition to being Suicide Prevention Month, is also National Recovery Month. So I'm really honored to be following Reina and Jorge today as they share important information about the symposium. And we really work together in Monterey County. That's one thing I'm very fortunate to say. And we're all united in helping to break down stigma and to have conversations about substance use, mental health. And today I'm here to talk with you more about suicide prevention and awareness. I did want to share a little data with everyone so that we can understand some of the scope of the problem in Monterey County. So in 2021, we lost 49 individuals to suicide. So 49 deaths by suicide. And unfortunately, this represents a 29% increase over the past 10 years. Our population growth, by comparison, has been approximately 6%. So you can see that the rates are markedly higher in regards to individuals that are dying by suicide. It's really important to understand our data as we look at who we're losing to suicide, and in addition to who is having thoughts of suicide and attempting suicide. And so as we look at our data, we found that in 2021, more than 50% of suicide-related deaths were amongst adult men using firearms. And I bring that into the conversation just so that we can all begin to think about, so what do we do with that information? So from a public health perspective, that's telling us that we really need to be directing campaigns and messaging, in particular to adult males, and also developing partnerships where maybe we haven't had partnerships really related to firearm safety. And so if you are interested in being a part of active efforts to address suicide prevention and really take a data-driven approach, we invite you to join the Monterey County Helping One Another to Prevent and Eliminate Suicide, or the McHopes Coalition. We have a lot of information listed on our Monterey County Behavioral Health website, and I'll put that into the chat a little bit later. And looking at our data too, we also really want to understand what's happening with our youth and our young folks in our community, because we are seeing rates rise. I don't have the data today to share with you. We're still looking at that. However, we have seen national trends where Black and African American children and youth are having increased rates of suicidal thoughts, also known as ideation, and also higher increasing rates of dying by suicide. And we also have seen over time, and I think that the data still would be true, that individuals who are Latina teens, so our female Hispanic and Latina teens have higher rates of suicide attempts. So that is important to know. So we want to make sure that our messages are culturally and linguistically appropriate when we think about who we're communicating with, because we have different ways that we share information with youth and young people than we do with other populations, just because that we all receive and respond to information differently. And also really the importance of speaking with parents. Just as for the drug overdose symposium, I apologize if I said that wrong, but just as important in terms of understanding signs of drug use and to know how to prevent overdoses, we have to really inform our parents and educate them so that they can understand warning signs of suicide in our children and our youth. So Karen, if I still have a few minutes, I wanted to go over a few resources. Is that okay? To share some online resources?
That would be great. That would be
Okay.
great.
So bear with me. As you know, we start things and then it always changes going from practice to action. Are you all seeing the Know the Signs campaign? Okay.
Yes.
So this is a really great website that I want everyone to know about. The information is available in English and also in Spanish. So the campaign is fully bilingual. But we're going to go back to the English page because that is my primary language. But I just want you to know that all these resources are there in both languages. There's three main areas that we want everyone to know about, because we all have a role to play in suicide prevention. It's not just the behavioral health professionals or the medical providers, it's all of us. And so the three main goals of the campaign, one are to know the signs of suicide, two are to find the words, because sometimes that's the hardest thing to do, is to have a conversation with somebody that you care about or somebody that you're working with. If you're in a professional capacity and working with someone, it still is hard to ask somebody if they're having thoughts of suicide, if you're not comfortable with having that conversation. And then what to do to reach out. So I'm going to just walk you through the next screen because I think this is really a great place to go and to use for information. So on this page, you'll see different signs of suicide. And this is now more in the adult population. So you'll see things like putting affairs in order. And then if you hover over the circle, it'll share a little bit more about what this means. And so one example is talking about suicide or wanting to die. So for example, my friend used to say things like, I just can't take it anymore. I just want to end it. And sometimes we'll hear statements like that. And then we really want to encourage people then to find the words, to then know what to say, because it's really important to ask directly about suicide. Sometimes people think that that will make the individual more likely to attempt suicide, but that's one of the myths we want to dispel. Asking somebody directly, are you having thoughts of ending your life? Are you having thoughts of suicide? Are very important, because it's very important to be direct. And so this page helps you to go through prompts around starting the conversation, listening, expressing concern. I thought this was helpful too, what not to say, because it's human nature to want to minimize somebody else's pain. And so we might say things like, oh, it's really not that bad, or you're not thinking about suicide, are you? Because we want that person to be okay, and we don't want them to be in such distress. So just know that it's just more important to listen and to acknowledge and to validate what that other person is feeling. And then in terms of reaching out, one new state and national resource that we're really excited about is 988. That is the 3-digit suicide prevention lifeline number that was launched, I think, last month. I was here speaking to some of you about the launch of 988. So that just makes it really easy to remember. For example, I can't tell you right now what the longer 877, actually I do know what it is, number is, but I don't want to misquote it. So it's an easy number for all of you to know, to put out on social media. And this hopefully will be updated soon, but there are other resources here, some statewide resources. There's a crisis text line, 741-741, and different information for our community. Also, I found this handy. You can go to, for example, Monterey County if you want to know what's happening here. And I wanted to make sure that everybody knows about our Monterey County Behavioral Health Access Line. That is also answered 24 hours a day, 7 days a week, to help connect people to care. And then Karen, if I still have a couple more minutes, you might see down at the bottom, there's Suicide Prevention Week kit links. I'm going to just go directly there. And there's a wealth of information for different folks to utilize in different ways around suicide prevention. So we're launching again suicide prevention. This campaign is a week. We are going to acknowledge it for the month and beyond, but there's specific activities, and our theme this year is thriving at all ages. And it's really nice because there's some specific resources for older adults. They are also a vulnerable population, and we don't often really resource our older adult community in the way that perhaps we're focused in other communities around suicide prevention, but it's just as important to talk about that at the kind of older end of our lifespan, in addition to talking with our teens and our young folks. And so I would really encourage you to explore this website. And if you'd like to sport a lovely Zoom background like I am, that's on here too. I do have that in the chat to share with you all. And some social media posts. So if you are in charge of your organization's social media, or you would like to share it on your own social media, we really encourage everybody to do that. There's some really nice bilingual images and messaging. So they make this really plug and play, as you might say, really ready to go for folks. And so I'll put all that in the chat. Let me think what else I want to share with you. I also wanted to take an opportunity to announce that September 10th is National Suicide Awareness Day, and we are partnering with some awesome community-based agencies, Sun Street, Interim Incorporated, Partners for Peace, the Epicenter, the Health Department, the Boys and Girls Club, the City of Salinas. I'm sure I'm missing some folks, but you can tell it's going to be a great time. We're all coming together on September 10th at Sherwood Park. It's an open community event. We'll have raffles and resources and entertainment, because part of suicide prevention is also taking care of our health and our wellness and well-being. And we want our community to know the resources that are available and that help is out there, and that there's no stigma or shame if you need some help in taking care of your health or your mental health. And it's a couple other cool things. The County Board of Supervisors is going to recognize September as Suicide Prevention Month, issuing a proclamation that will be presented on September 13th. And so join us in person or Zoom at the County Board of Supervisors if you'd like to show your support for suicide awareness and prevention. And then we also have created a really simple activity, and Karen, I'm sure you can send out to everybody, hopefully later today. We have we thought together, well, what's something really simple that everybody can do to help share messages of hope? And so this year we have crafted an overview of how to just create a very simple wall of hope, where all you need is a space, some sticky notes, a writing utensil, and the ability to write and to put it on the wall so that you can say encouraging messages for other people. And also, if you're in a space where you're having a low day or need some support too, you can take a message of encouragement. And we have those available in English and Spanish. And I am not bilingual, so I'm not even going to attempt to tell you the title of what it is in Spanish, but we have that ready to go. And I think I have shared everything I'd like to share with you today, and I'm also open for any questions. So thank you for your time.
Any questions from anyone?
And I'll put those links in the chat real quick.
Yeah, and I will send out the activity that's available in English and Spanish. It's a great, like Dana said, all you need is a space, some sticky notes, and a pen, and people to participate. And I think it's a simple, easy way to celebrate our wellness, the wellness of the community. So I'll wait a little bit. Any other questions? It doesn't look like it. Well, thank you everyone for joining us today. Our next briefing is next Wednesday, and we will see you then.